Hello and welcome, everyone. I'm Dr. Tom Chaney, and this is Living Health Live. Joining me on the show, as well as in life and in our practice, Living Health Integrative Medicine, is my wife, Dr. Ste Chaney. We are your trusted source for the latest information to help you get and stay healthy naturally. We're very excited to be joining you and taking you on this adventure of a lifetime, your lifetime of great health. You're going to get some awesome information, strategies, and the latest research on how to live better and a healthier life. Just remember that this is intended for educational information only. The information given here is designed to help you make informed health decisions, not intended as a substitute for medical treatment. On today's episode, we are discussing the IV advantage for fighting chronic fatigue and long COVID. We're going to go through some of the definitions of these conditions. We'll go through some of the common symptoms that we see with patients coming into the practice. We'll go through some of the causes, and then finally, we'll wrap up and discuss some solutions to help you fight these conditions. So let's start with some definitions. So, Dr. Steph, we're going to talk about chronic fatigue first.
Yes. So chronic fatigue syndrome, or another term for it medically, is myalgic encephalomyelitis, which alludes to the fact that there is an inflammatory component, especially in the brain and muscle complex. It's a complex multifactorial condition. And it has uh, several potential causes, but ultimately, it comes down to one thing that we're going to really get to the root of. The
So go back
symptoms.
to the other the last slide. You were talking about multifactorial. So just meaning it's
It
many
has
different
many.
systems in the bottom in the body.
Yes,
Okay.
yes. So we'll get into the main causes. So the symptoms that people complain of, it's not just fatigue, but there's usually with this syndrome several other systemic complaints. But yes, severe fatigue, and it's not just like, once in a while you stay up too late, you wake up kind of tired, or you've had a really long rough week and you want to sleep in on Saturday kind of thing. This is for some people just debilitating uh fatigue, like they dread just getting out and facing the world every day kind of fatigue. Um Difficulty sleeping. So a lot of these patients, even if they sleep 7 to 8 hours a night, are waking up completely exhausted still, or they're tossing and turning sleep. They're having active sleep, like their brain is still on and they're not fully rested. They can complain of headaches. Can be low grade daily headaches to severe migraines. Joint pain is also a very common thing, and it may be kind of roving. So it's not always the same joint. If somebody has arthritis in their knee from a football injury, it's constant chronic pain. This is pain unrelated to injuries, and it kind of moves around. So it might be in their elbows for a few days, and then they wake up and they've got something in their knee, that kind of thing. Muscle aches. So even the diagnosis of fibromyalgia, which is really just technically a fancy term for pain in your muscle fibers, doesn't really say why the person has that pain. Again, that can be also intermittent and roving. So it can be moving around. Difficulty with thinking. So brain fog, concentration issues, even a diagnosis of ADD linked with this. Vision problems, so blurry vision, really watery eyes, floaters, things like that. So temperature dysregulation, not able to stay warm. They can get chills, like almost like any point, any season. It could be in the summer, and they suffer from chills. And then night sweats is not an uncommon thing as well. Night sweats is different than hormonal issues, with perimenopause, where they get hot flashes. That's more of a dry hot. This is, people could wake up just drenched. And again, it may not be all the time. It might be intermittent. Sometimes people are complaining of swollen lymph nodes. And again, it can be moving around. It may not be all the time. Often just the feeling like they're always fighting something, always sick. If they get sick, like if they get a common cold or flu, it just lasts forever. So instead of the 48 hour, 3 day, whatever, the person who might be down for like 2 to 3 weeks. And a lot of gastrointestinal issues. It can range from GERD to leaky gut to irritable bowel, and many times even it's severe as ulcerative colitis, celiac disease, things like that. And then mood swings. So even just seasonal affective disorders, down, rage or feeling like not motivated, kind of depressed, wanting to do things not inspired creatively like they may have been at one point. So a person can have all of these, and they may just have the fatigue. Oftentimes may start with fatigue and progressively grow to these other things, or one or more of these other things happen, and then the fatigue comes. And we'll get into reasons why that happens as well.
So, what are some of the causes of chronic fatigue?
So a big factor, especially with our patient base, is called CIRS, CIRS, biotoxin illness. So let me just kind of clear up a couple of those definitions. So CIRS is chronic inflammatory response syndrome. We sometimes just call it for ease biotoxin illness. So a biotoxin is a toxin from a living thing, whether that's mold, bacteria, parasites. It can be in you, so you can have overgrowth of bacteria, mold, or parasites, yeast, fungus, things like that. Also be bacteria, mold, algae, and things in the environment. It can be something you ingest. The biotoxins can be something you inhale. It's basically metabolic waste from these organisms. A virus is really not a living thing. And so I actually categorize that as a biotoxin. So a virus itself is a biotoxin, protein encapsulated in a liposome, like fat. It's just basically genetic junk, it's cellular garbage, elicit an inflammatory response, just like a flu, just like a biotoxin. These two things actually trigger the immune system the same way. Toxins, whether you're getting a venom can even be a biotoxin, for example, from a snake or a spider or an insect. Vaccine is, in essence, a biotoxin. It is full of viral particles. It may have toxins, that waste from the infected bacteria that they're growing these things in and culturing these things. There's a lot of stuff in there that is very prompting to the immune system. So whether you're getting injected or bitten by something, or you're inhaling something or ingesting something, or you have something growing in you that's producing and shedding toxin, waste products, body should be able to clear most on its own. Uh, Base toxins will get processed by the liver into the bile, and bile will get gallbladder and then secreted into the small intestines, and you're supposed to poop them out. So, for example, if someone's in a moldy building, they're working there, or they live in a house that's had water damage, or what it may be,
Maybe bit
they,
by a tick?
right, or a snake, really bad spider bite. Eventually, the system's supposed to clear the toxin, clear the venom, clear whatever. You remove the person from the moldy environment, water damaged building, and they should be flushing and clearing it out. Water-based toxins will come out through sweat and urine, but these fatty ones come out through the bowels. Well, in about a third of the population, they have a genetic susceptibility to not doing that. So instead of pooping the toxin out, the bile goes through the small intestines, and they apparently reabsorb the toxins back into the system, back to the liver, as though they had consumed food. So the toxin never leaves the body. It gets modified into these weird protein fat kind of complexes. And it's the fact that they're protein fat complexes that causes a lot of problems, because this is what triggers the viral immune response. But they also are very easy to get into fatty areas of the body. They can get into the cells because these fatty things can get in and out very easily. The brain is 70% fat. Your nerves all around your peripheral areas are coated in a myelin sheet, which is basically a fatty cholesterol waxy substance. Your glands, all your cell membranes, your hormone receptors. So this stuff can get around, and then eventually can create really dramatic acute inflammation chronically. And that just sounds exhausting when I say that. Like, That's ultimately what happens. So it's not uncommon for a person who's had exposures long term over and over to multiple biotoxins. And eventually, at some point in life, whether they're very young or older, they kind of succumb to the effects of being acutely inflamed chronically for so long. And one of those effects can be exhaustion of the cell's ability to produce enough ATP or energy, and the person starts to suffer from chronic fatigue. Um, so there is a genetic susceptibility. That's one of the things we actually test for when someone comes in complaining of chronic fatigue. We have to rule this in or out as a situation. And I'm going to say about 99% of the time, the patients that we see, this is what they end up testing for is a genetic susceptibility. Generally, there's exposure. The exposures could have started like decades before, and they're still carrying around toxins from way back when, but they're getting exposed to other things as they go. They move from one house to another, one office building to another. They get multiple vaccines through life, um, all kinds of different ways of getting exposed. But the stress can be a factor also. So it can be that the person's handling to some degree the toxic load. And then some stressful event happens, whether it's a car accident, like a fender bender, could be enough. Could be a dramatic loss of some kind, whether it's a loss of the job or a loved one or something like that. Just stuff like that could be enough that it's too much stress now, and now the system cannot, it can't keep up with the handling of the toxin. Eventually, this chronic acute inflammation leads to brain dysregulation. The brain regulates all of your hormones throughout the entire body, which manages a lot of your systems. It leads to hormone imbalances because of that. Your immune system gets completely overrun and exhausted. You become hypoxic, so low oxygen due to circulatory issues related to this. So people literally sometimes are just describing like they're always out of breath. There's like it just to get upstairs, they get to the top and they're like they could be in shape and exhausted and out of breath, like they're gulping for oxygen. Um, they can feel like numbness and tingling, almost like their hands are asleep just from moving around too much. They start to suffer from nutrient depletion, malabsorption with the gut. Where we talked about the gut issues, so we have a lot of malabsorption issues. So it's sort of like one thing starts to lead to many, many, many things. And a lot of times these patients come in and they've been to multiple specialists and they're on multiple different types of drugs, sometimes drugs for antidepression, ADD, for gut issues, inflammation. They get oftentimes diagnosed separately with an autoimmune disease. So they may be put on medications for that. But the ultimate bottom line cause of the exhaustion is the mitochondria, which, if you remember from biology class, is the little tiny squiggly things inside a cell. These things are the furnaces, they're the energy makers of the cell. They take oxygen and vitamins and fatty acids and things like CoQ10 and antioxidants. They take all of these things, vitamin C, B vitamins, things like that, and they make ATP, which is the energy molecule for the cell. So if the cell cannot produce ATP, the cell will not function. And if the cell does not function, mainly making proteins and messaging and coordinating, then everything just kind of starts to fall apart. And so that is sort of like a complex cyst situation. um, and we have to rule this in or out with a chronic fatigue patient, because if we do not, then we will not be able to handle on any of the major contributing factors to their chronic fatigue. And they may always stay in a state of chronic fatigue, um, uh, regardless of what they're trying to do on the surface to overcome it, whether it's, extra sleep or caffeine or stimulants or ADD medications, which is basically cocaine speed, essentially. That's what Adderall and stuff is. So these people are running like they're trying to override. Um, and unfortunately, those things can lead to even more fatigue, ironically.
So we can test for some of the genetic susceptibilities, like you said, right?
Yeah. So we
And
did
then
that
and then
through
you mentioned
LabCorp. Mhm.
and then you mentioned the mitochondria, so we can actually do some testing for the mitochondria as well, right? To look for how good the
Yeah.
mitochondria are functioning.
Yeah. So we'll usually do a screening for the genetic marker and a couple of the acute inflammation markers. These are proteins the immune system secretes when it's acutely inflamed and attacking a virus. Um, and we will also, there's a lot of different tests we'll run for hormone imbalances. We do that usually through saliva. We can do that through blood or urine. We'll check your cortisol. That's another hormone that becomes very dysregulated that manages your sleep wake cycle. People can get into complete depletion of cortisol and end up adrenal fatigue, which is a contributing factor. We do that through saliva testing. We do a very comprehensive urine test for several markers. And in that urine test are several mitochondrial markers. So we can see if a person is just completely bogged down by mitochondrial stress, um, or if we're catching it early and, we're expecting a quicker turnaround as far as that goes. But there's very specific protocols. If someone is genetically susceptible to biotoxin issues and SIRS, then there's specific protocols that we basically go off a checklist to handle what's happening in the body, to back it out of that inflammatory cascade, and then also addressing environmental issues in the person's immediate environment to make sure that they're not being exposed to large amounts of biotoxins, both externally and internally. These are some other things that will contribute to, and this, again, this could be related to SIRS. It could just be related to chronic stress. I mean, people are just exposed to a ton of toxins now. There's, a lot of high stress situations that we're dealing with, more so now than, you know, hundreds and whatever years ago. We have different kinds of stress. Um, so thyroid imbalances, obviously, if someone has got thyroid issues, thyroid is the hormone that basically pushes the metabolism. It runs the metabolism. So if there's too much thyroid hormone, people are going too fast, right? They're kind of manic. They don't sleep. They've got insomnia and heart palpitations and jittery and kind of like that. But if they're low functioning thyroid, or if they're having gut issues and gut inflammation and liver inflammation, they may not be converting hormones. We've done lots of webinars. You can go on our YouTube channel and look up thyroid under our channel. I've done lots of webinars on the thyroid and how it may not be just like what the thyroid is producing. It may be how your body's using or converting or activating the thyroid hormone. Most of the thyroid hormone is actually activated or converted into its active form in the intestines and the liver. And so if you've got liver and intestinal issues, you may not be converting it. You may actually be very low in the active form of it, and it's not very often tested for. And a lot of people aren't given support for that. So that's the thing to rule in or out, which we do on our functional blood panels. Adrenal abnormalities. So it's just the cortisol issues, hormone issues. We will be checking that through thyroid test. Saliva testing. Diabetes. So type 1 is autoimmune. Autoimmune, usually I will be ruling out in or out SIRS. I am finding that most people that succumb to a triggering of an autoimmune issue are actually biotoxin susceptible, and the SIRS may be the underlying contributing factor or association with that, or trigger, ongoing trigger, right? But type 2 diabetes is also a contributing factor for a total exhaustion. Y- You've got, issues with blood sugars, insulin resistance. So now the cells aren't listening to insulin. So there's less uptake of lots of things, not just sugar, but proteins, fats, all kinds of things that way, especially into the muscles. When you have muscle fatigue, you will have chronic fatigue. Um, you have very poor circulation, we have clogging of the arteries, small blood vessels. So that can lead to issues as well for brain, nerve, and muscle function. So that is really common with our type 2 diabetics. Anemia. Anemias, there's different kinds of anemias, and they can be caused by different reasons. Nutrient deficiencies can lead to microchromic microcytic. This is red blood cells are not fully formed or healthy. and red blood cells carry your oxygen. So if you're oxygen starving because of any of the anemias, whether it's the B9, B12 anemia, or it's iron deficiency anemia, very rarely does that even get screened for. Um, Ironically, Medicare doesn't cover iron testing, just routine for people.
It's
Um,
unbelievable.
I know. Unless there's extreme fatigue, but even then, sometimes it's just not even. It's like this, not even whatever, and that can be contributing. So, like if I have a female patient and she's still menstruating and coming around perimenopause, and all of a sudden it's like the irregularity in the cycle, and now she's actually menstruating for 10 days instead of 5, and there's blood loss. Blood loss is really how you become iron deficient. Nutrient deficiency, kidney stress, SIRS, inflammation, chronic illness that can lead to the B12, the B9 deficiency. Um, uh, and that can cause fatigue and anemias that aren't related to blood loss. And you can have all of it because you can have iron deficiency and the B vitamin deficiency and all the other stuff going on. So those things are things that we have to look at. So we do assessment of iron levels through our blood panel. That's our thing that we do initially. B12 and B9, I will look for different blood markers from a functional perspective, like homocysteine and your red blood cell markers to see. Regardless, I don't really care what B12 and B9 levels are in the blood itself. I care what is happening like with it. Like, is the body using it? Do you have a higher need for it? Is there a cellular manifestation of needing it, of a deficiency? Urine testing for metabolites of how your body's using it. That's an important factor as well. Looking at mitochondrial stress markers, like we said before, in the urine, because mitochondria are absolutely dependent on the B vitamins. So there's other factors involved. I don't really um, we can do intracellular micronutrient testing through a lab called SpectraCell, do micronutrient testing. And that's good that they'll actually test the amount of vitamins, amino acids, minerals, things like that in the cell itself. That's a more real test for me than just what is kind of, circulating around the blood. Um, and then, of course, we can have post-infection fatigue syndrome. This is sort of like, if someone's susceptible to SIRS, they're more likely to get this, right? They're not as likely to overcome chronic infections or an acute strep throat or viral infection. COVID, for example, is a big factor. So, um, this is sort of a subset of chronic fatigue that's characterized by like a person had a trigger of this infection, and ever since then, they haven't been able to regain their previous energy levels. And COVID is a huge thing. This is something we've seen in the last few years. It's still happening to people. People got COVID multiple times. This could be actual post-vaccine COVID vaccine, because in a large way, that particular um, mechanism for that vaccine was to cause a body to produce the spike protein and elicit an immune reaction. The problem is the spike protein is the biotoxin. So if you're susceptible genetically to not being able to process and eliminate biotoxins, and now you're producing the biotoxin because of this vaccine, then you could actually have long COVID symptoms because of the vaccine and immune depletion, and it could be the trigger for chronic inflammatory response. So this could the COVID or the COVID vaccine or any vaccine actually can be a trigger. The two most common ones I see are Gardasil and COVID vaccine actually um, uh, becoming a problem for a genetically susceptible SIRS patient. So there's a lot of, you can see it all kind of goes back to, whoop, does this patient have a genetic susceptibility to literally having chronic fatigue because of that, inflammatory reaction?
All right. So let's move on to long haul and post COVID. What is that all about? Talk
Yeah.
about some of the.
So post COVID is, like I said, it's just like a person got COVID, they were one way, had COVID, and then have never been the same. And I've seen it I've seen the manifestation of this like all across the board with some of the craziest things. But it's kind of known as long COVID, long hauler. I don't really use that term much, but long COVID, chronic
Hmm.
COVID, post COVID. That won't go away sometimes for months. Sometimes it's just been like we've had patients now that have had it for a couple of years or more. Up to 80% of those who got COVID-19 actually end up with chronic symptoms, depending on, who you're looking at. For some people, the lasting COVID symptoms are nothing like their original symptoms, like when they first got infected. So they first got infected, they had like headaches, flu, they might have had GI stuff. Um, but then like months to years later, they've got neurologic deficit, neuropathy, trigeminal neuralgia, Bell's palsy, the chronic fatigue, autoimmunity, triggered later. Um, so their symptoms like totally might not be the same as when they had COVID. It could be either from the COVID vaccine and or the COVID itself. Ironically and very disappointingly, many patients who got COVID vaccinated still got COVID, and may have gotten it multiple times. Um, but it's like that vaccine became almost like a chronic infection. And so
Mm.
that could be the thing that sort of set off or triggered an already existing underlying SIRS condition. So it's almost like it kind of contributed to an acceleration of this person developing SIRS issues, like chronic fatigue issues. So instead of maybe them getting something because they were genetically susceptible in 10 years, well, now they're getting it like it's sped up. That's sort of kind of what I've witnessed and observed. So as far as who's experiencing the long COVID, it's really the biotoxin susceptible, the genetically susceptible to SIRS biotoxin illness population.
So they go hand in hand. The-
Yeah,
Yeah.
yeah. So before COVID, it was most of my SIRS patients where it was molds or environmental biotoxins or parasites. Parasites are extremely common in people, and they're massive producers of biotoxins. They shed their own waste, they shed their own viruses, all that kind of stuff. And then the one of the genetic susceptibilities actually will come back reporting that that person is very susceptible to biotoxin issues if they get a Gardasil vaccine. So that's actually like a documented research thing. So since COVID, now I find that COVID is the trigger as well. So if a person kind of went into COVID and was working in a moldy building and might have had parasites and all like, but they were kind of getting away with it, like their system was sort of dealing with it. And then they got COVID or they got vaccines and then they got COVID. Now it's just sort of like that's an amplified thing. So um, a lot of people I think that are getting over COVID quick, never had a problem, never had an issue with the vaccine, da 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 da. These are probably just not genetically susceptible people, and their body can actually flush out, process, and handle a lot better than than the chronic fatigue susceptible patients. So as far as like the symptoms of long COVID, the shortness of breath. So remember I talked about like the gulping for oxygen, right? So very
Hmm.
oxygen deprived, tachycardia, or bradycardia, or POTS, and POTS is postural orthotic uh, pressure issues. So this is a person who gets up real quick and starts to feel like they're going to pass out. They get very lightheaded. They get dizzy easy.
I've seen a lot of that recently.
Oh yeah, they run up to the top of the stairs and they're just like like they have to kind of stop. That has uh always before COVID for me been associated with chronic inflammatory response, biotoxin issues, because that is a brain dysregulation of the hormone that regulates pressure, antidiuretic hormone, ADH. And so now we're seeing that because of uh, this this long COVID or vaccine COVID reaction. So it's very like these are very much the symptoms of chronic fatigue,
Hmm.
ongoing debilitating chronic fatigue, very common, lack of motivation, all the symptoms listed on chronic body aches, joint pain, loss of taste or smell for some people that lasts for a year or more, um, difficulty sleeping. Uh, so that could be insomnia. to the point of like hyper sleep, hypersomnia. Just you can sleep 14 hours and still feel
Hmm.
exhausted. Headaches, brain fog, concentration issues, memory loss, speeding up of dementia, things like that. Nerve pain, neuropathy, fibromyalgia, and I've seen the neuropathy be kind of anywhere. I've seen just like crazy, inexplicable, almost undiagnosable. Like patients have been going to multiple neurologists, multiple orthopedists. They've tried nerve blocks, they've tried everything, and they're not responding. And it's likely because there's this still present accumulation of toxins that's just triggering the immune system to be attacking the nerves by accident, because that may be where the toxins are embedding themselves. And then skin issues, autoimmune diseases, and on and on. But autoimmune is the biggest one. That's any autoimmune disease. I mean, just pick your autoimmune disease. We've had patients with Guillain-Barré where it's like
Hmm.
full blown paralysis. Some people that are diagnosed with chronic fatigue are actually diagnosed with autoimmune encephalomyelitis. So it's they can acknowledge medically that it's autoimmune, but they just don't have a way to properly and effectively get down to the root of handling it for that patient. So conventionally, there's not really a lot. Like nobody
You
knows
go to your
anything.
conventional doctor, you go to your primary care doctor, and you tell them you're fatigued. What's the answer?
Or whatever symptoms you're presenting with, right? So like whatever doctor specialist you end up getting referred to for the headaches or the neuropathy or the autoimmune issues or the fatigue or the fibromyalgia or the whatever, it's like you will just as essentially just get medicated for that symptom, right? But
Right.
there's no addressing the underlying issue, which is this genetic predisposition and ultimately a massive accumulation of toxins in the body that the body can't get out. That's just triggering constant attack inflammation. So our approach is, we take this root cause approach. We have to get down to the root of everything. Why is this happening? What's happening in this patient's life that's aggravating it now? Um, and then we take a holistic, multi-system integrated approach for basically SIRS biotoxin, and I put parasites in there because it's not just mold and water damaged buildings and viruses and things like that. So we do pretty in-depth testing with lots of different types of tests, blood, saliva, urine. We do something called meridian testing here. That is an energy type of test that allows me to get down to more of a quanticellular atomic kind of level, and help determine protocols and things like that. It helps me determine if a person has parasites beyond just what might be in their colon. That would just only a stool test would show that, for example. Um, and then we create individualized supplement, herbal and medication protocols based on the individual needs and the protocols that they need. So some people do need prescriptions for a period of time where there's parasite meds or antifungals or biotoxin binders or IV therapy. Like there could be all kinds of reasons to have somebody on a short-term protocol. But it's much obviously more workable when we do it complementary with other things that we have. But our goal is to handle inside and out environment, um, take the pressure off the person's immune system, restore some of the nutrients that were lost, handle some of the underlying triggers that are continually hammering the immune system, driving it to exhaustion. Um, One of the biggest things that we find very helpful and is ozone IV
Hmm.
and various vitamin IVs. We've got a protocol now for chronic fatigue and long COVID, specifically for our patients. And the combination of ozone and the vitamin IVs is really, really helpful. We've done whole podcasts and webinars and videos on ozone. There's so many different applications of ozone for treatment purposes. So I encourage everybody to kind of go back and look up one of our ozone podcasts or videos, see what that looks like, what that's all about. But the biggest thing now is that we've got some IV vitamin protocols that are really, really good for supporting the nutrient deficiencies, the anemias, the the immune system, uh, restoring brain and body regulation, getting energy cycles back up, healing from nerve damage and brain damage. Um, and so those are some things that we're pretty excited about, uh, that have been helpful for a lot of our patients with the chronic fatigue. We've actually seen, and some of our patients' medical doctors have actually commented on changes in their blood, getting, for example, the B12, B9 microchromic microcytic anemia markers, where the person looked like the red blood cell markers were so low they needed like an iron, like they would have gotten a blood infusion. And through a series of the chronic fatigue protocol IVs, it actually restored their blood values back up. And uh, that's just not something that most conventional doctors are doing, unfortunately. So
Plus, it's very hard to get the quantity that we're giving people through these IVs, like through in the in oral form, you just can't get them. Plus, most people, their GI tract is so
right,
unhealthy,
their
you can't
absorption is
absorb
not
it.
great, yes. So
Right.
we still do oral form, they're not getting IVs every single day,
Right.
these are usually weekly IVs. Our chronic fatigue protocol, we usually start with 12 weekly IVs, and then we've got blood testing and intermittent check-ins, and reassessments as we go. Um, and, for many patients, they may actually be covered by insurance, or partially at least covered, so their insurance may contribute to, helping offset the cost, which is kind of great, specifically for fatigue and specifically for long COVID patients.
All right. Why don't we talk about some of the nutrients that these patients are deficient in?
Yeah, it's a pretty bomb diggity IV. It's loaded. So we've got basically a vitamin B and electrolyte mineral bags, commonly known as the Myers cocktail. So that's there's going to be an IV of that. And then there's an IV of high dose vitamin C. We sort of do a mid range 25 gram. So 25 grams. Let's think about that for a
Yeah.
second. Most people are taking 500 milligrams once or twice a day, if they're lucky. Um, but one of the things that we find very low, almost across the board, maybe 90% of patients when we're doing our urine tests for the micronutrients, is they come back low in vitamin C.
Right.
And vitamin C is pretty remarkable. It's got some, anti-cancer effects. It's antiviral, as is ozone, but it also helps stimulate the immune system and whatnot as well. So that's very helpful. We'll go into like the specifics of each of these, and then the other things that are in this vitamin bag, vitamin IV protocol is glutathione, biotin, taurine, and B12. So let's get into the specifics of each of these things. So Myers cocktail, just in and of itself, will improve immune health, which a lot of these patients need. Um, is very indicated for chronic fatigue, so it'll help with boosting energy. It provides some of the basic nutrients that your mitochondria need. Um, and when we flood the blood with these higher amounts than you could get in via oral, it just allows more of it to get into the cells than maybe otherwise the person's getting. It helps with acute viral issues. So again, long COVID or COVID vaccinated patients are still dealing with chronic biotoxin, which is a virus biotoxin for me are interchangeable, right? So it helps with mental clarity, cognitive function, muscle strength and support. That's the bank of most of your energy and mitochondria. That's where the fatigue will come if you've got weakening muscles.
And helping with the fibromyalgia symptoms.
Right. And just think about it. Like you get chronic fatigue, you get kind of laid on your butt, and then you become inactive, and then your muscles atrophy, and then
Hmm.
you have less of a furnace. You can't do more. If you do less, and you're more tired and you do less, and you get more muscle atrophy, and you just sort of like it becomes this downward kind of spiral. So the Myers also helps with athletic recovery, performance, mood, decreased anxiety because of the B vitamins. And it's just you're just getting stuff right into the system. Can help with migraines, respiratory issues. It's just good. It's a good, easy little bag. Anyone can come in and get a Myers cocktail, um, kind of anytime. Those are pretty, uh, common. The high dose vitamin C is less common, especially at the dosing that we do. You're not going to usually get these at an IV bar. These you definitely need to be medically cleared for. But the high dose vitamin C helps boost the immune system. And vitamin C is an antioxidant. It helps improve energy levels. So very much indicated for fatigue, antiviral. It improves neurotransmitter levels. These are the chemicals in the gut and in the brain that make the brain go shut off when it's supposed to, run when it's supposed to, have you be focused, happier moods, things like that. Helps reduce inflammation, which again is what we're trying to accomplish with our chronic fatigue patients. Helps with bone density, collagen, skin, all that stuff. All needs the collagen. The basis of it is vitamin C. So anywhere in the body that needs collagen would benefit from high dose vitamin C. Very good support for cancer patients. Um, Whether they're doing traditional treatments or not, we have a lot of our cancer patients that are getting chemo, but they're also coming in and having the vitamin C IVs. And even if it's just to help support the immune system and keep it healthy while they're kind of trying to kill cancer with the chemo. And then they have used it obviously for sepsis, which is acute blood infections in hospitals and things. So vitamin C is very powerful.
And check out our past podcast if you want more information on vitamin C. We had Dr. Levy. He's the author of Primal Panacea. So we got into all the details
Mhm.
and all the benefits of vitamin C.
Yeah. Um, so you'll have a Myers bag, and then you'll have an additional 500 cc bag of the high dose vitamin C. So obviously, even the fluids will be helpful. Um, and then there will be additional what we call pushes into the IV line. One of those is glutathione. Glutathione is the master antioxidant for the body and supports all functions, but helps support the liver in getting toxins safely out of the body. It's a major component of liver detox, which you're doing all the time. It's not just
Mhm.
like talking about a fancy detox. Helps support immunity, helps with inflammation. So all of our autoimmune patients generally will benefit from glutathione. Helps with clearing heavy metals and other environmental and biotoxins. So it actually helps with binding and eliminating through the system from a cellular level all the way to the liver. And it helps maintain balance in the body. So this is one of the pushes that will get introduced while you're sitting and getting your IV. Biotin, most people know that to be a vitamin helpful with uh, or for hair, skin, and nails. But it also helps improve nerve function, brain function. It helps with metabolism. It helps with maintaining eye and kidney health, so small blood vessel areas. And it's very important for healthy sugar metabolism. So again, when we're worried about diabetics being more prone to things like fatigue, this is a very helpful thing for them as well. B12. Most people have heard of B12, getting B12 shots. We do have B12 shots in our office, but when someone is getting this protocol, we'll put it into the IV as a push because they're already set up to that. But B12 helps with a myriad of things, metabolism, so nutrient digestion, absorption, elimination, respiration, circulation, temperature regulation, all of the things our chronic fatigue patients have a problem with. Blood cell production, so it helps carry oxygen throughout the body. Energy levels, right, because it supports mitochondria need B12 in order to produce ATP energy. Also helps with eye health, skin health, hair health, brain and nerve function, homocysteine regulation. Homocysteine is a metabolic inflammation marker. It's very damaging to blood vessels, cardiovascular issues. Um, Very high in a lot of our neuropathy patients. But it will help with lowering that as well. That is regardless of the big thing right now is testing for MTHFR and genetic homocysteine issues. I don't even like, I'm seeing homocysteine high and the need for B12 in people, whether they have MTHFR, like genetic issues with it. Everybody needs to be methylating right now. Everybody needs methylated B12, B9. And so I, if someone's genetically susceptible to having problems with detox and needing higher amounts, well, what am I going to use to assess that? It's homocysteine levels and red blood cell markers, regardless. So save your money, if you want to run the test, we can run it. But I regardless to monitor it, I need to run those things anyways because we're not going to change the genetic susceptibility. And also helps with bone health. So you can see how these all work together systemically. Taurine. This is an amino acid, and it's essential. So it's not something that we get and can make on our own. We have to actually consume it. And it supports healthy immune function, contributes to regrowing of new brain and nerve cells. So yes, you can actually grow new brain cells, but you need to support that. Promotes long-term memory function of brain, helps calm the brain, and assists with sleep and the circadian rhythm. So it helps get the regulation flow back. It has antidepressant effects, healthy heart function. Um, Deficiencies in taurine has been associated with cardiomyopathies. And this is a big issue with our SIRS chronic fatigue patients, as well as our COVID patients. Helps with lowering blood pressure, healthy muscle function, metabolism, and energy. So you can see how this would be a pretty important push for our chronic fatigue patients. And so then the question always is, well, what's the protocol? What do I do? So the IV itself is going to take about 90 minutes because it's basically two IVs with additional things during the IV time. And it's just a matter of, comfort level and whatnot. But about 90 minutes is usually allotted. Sometimes it takes a little longer depending on the patient. We do recommend 1 to 2 per week, ideally minimally one. So most patients are coming in once a week to get their fatigue IV over a 12-week period. It's usually our initial protocol. And then we reassess based on that. And it's going to be kind of individual. Some people will do this alternatively with ozone. So they may come in one day during the week to get ozone and another day to get the IV, or they may alternate weekly. So 1 week they get ozone, 1 week they get IV, vitamin IV, depending on the severity of the condition and their schedule. So we always get asked about insurance. Insurance doesn't cover most IVs. These are just for run of the mill, like I just want to get an IV. They don't cover ozone, but most insurances have at least partial coverage for the medical necessity of a patient having chronic fatigue or long COVID vaccine issues. So that is something that we have to get medically cleared here. We have to determine medical necessity. You have to have a workup, a history. We have to run blood work to make sure that you're going to be able to tolerate the IVs. So basically, you just need to come in for an IV clearance. So we would just set you up with an appointment with one of our nurse practitioners that oversees the IVs, and they would look at your history, order whatever blood works they need to order unless you've had it done. And then if you're a current patient, we probably already have history on you. So you just still need to get an appointment with the nurse practitioner. And then we can put a protocol or a program together for you. Get your insurance verified. Obviously, we have to have your insurance verified so that you'll know what your out of pocket portion will be. There will be out of pocket, even with insurance, usually. But it's just nice to have this IV offset because these patients need so much nutrient and they're so depleted. They need more than just like a Myers cocktail. You know what I mean? They need
Mhm.
more than just a B12 shot. We're having to retrain and replenish and regrow brain and nerve and all this other stuff that they've been depleted with.
All right. So next step, if any of you out there that are listening, you're interested in coming in, is call the office for initial IV appointment. And you can call 410-216-6607. You can also email us info@mylivinghealth.com. So either one of those is a great way to contact us. And if you have any questions about today's episode, you can also send us an email at info@mylivinghealth as well. And I hope you guys all enjoyed today's episode. Thank you, Dr. Steph, for all that great information. And we look forward to seeing you on the next episode.
Bye, everybody.